Demystified Implications for Healthcare Providers and Business Associates. Today's presenter is Anupam Sahai, co-founder and president, Gestalt. Anupam is an accomplished management, marketing, and technology leader with 21 plus years of experience directing teams to develop and launch globally renowned products generating up to hundreds of millions of dollars annually. Prior to Gestalt, Anupam was Vice President Marketing for Encryption, Inc. He is a recognized expert in the areas of healthcare IT, cloud computing, security and compliance, networking, and is a featured speaker at several industry conferences worldwide. In this webinar, we wanted to tailor it for our future webinars to suit the audience. So we'll ask some demographic questions in the polls section of GoToWebinar. So let me ask our first question here. The first question is, what is your current status? And we invite all the attendees to vote or to list what their current status is. The options are covered entity, business associate, service provider, or other. And I'll close the poll in 3 seconds here. Okay, and the results are 49% are covered entity, 24% business associate, and 16% service provider, with 11% are other. Now, what is your position? The options here are executive, compliance related, risk privacy related, IT related, and other. So go ahead, please vote, and I will close the polls in 5 seconds here. And if you haven't voted, go ahead and vote. And pretty close. Okay, I've closed the poll. 36% are IT related, 20% risk privacy related, and 18% compliance related. Okay, our last poll. This is an easy one. Have you undergone a security risk analysis? Simply yes or no. Please go ahead and vote. And I'll close the poll in 5 seconds here. Okay, closing the poll. 62% of you have undergone a security risk analysis. 62%. Okay, great. If you have any questions throughout the webinar, please send them via the questions function in GoToWebinar. And if you can't find the question area, go ahead and use the chat function, and I'll be checking both throughout the webinar. And we're going to address the questions at the end of the presentation. If you'd like a copy of the presentation, please send an email directly to Anupam. There's his contact information or his email address, anupam.sahai@egestalt.com. I guess that's all the housekeeping stuff. So Anupam, I'll turn the webinar over to you now.
Thank you, Mike. Good morning and good afternoon, everybody. So the topics that I will cover today, I will start out by talking about HIPAA Omnibus and describe a summary of the changes that have taken place as a result of that. And then I'll talk about how do the changes impact covered entities and business associates. And as you will see, the definition of a business associate has been changed, which includes subcontractors as well. And then I'll talk about 9 steps to prepare for an OCR audit and what to do in case you do get an OCR audit request from OCR, Office of Civil Rights. And then I will talk about Aegify Secure GRC. It's an automated tool to manage end-to-end security and compliance. And I will also give you a URL to subscribe to a complimentary version of the tool that you can use to understand your security and compliance posture today. And then finally conclude the webinar with some remarks and Q&A. Before I start out, let me put some standard disclaimers out there. So HIPAA, HITECH, HIPAA Omnibus, these are topics that continue to evolve, and the information presented here has, we made every effort to ensure that the information is correct, but it is subject to changes, and so we cannot offer any such assurances, and there are multiple interpretations, and some of the interpretations are subjective. So please ensure that you consult your legal counsel for definitive information. Before I start out, let me start out by using and defining some vocabulary that I'm going to be using through the webinar. HHS stands for Department of Health and Human Services. OCR is the Office of Civil Rights, which is the enforcement agency for HIPAA HITECH. PHI or EPHI refer to protected health information or electronic protected health information, depending on which aspect we are talking about. CE refers to a covered entity. BA refers to a business associate. So let me jump right into it by defining what is a covered entity. And a covered entity is either a healthcare provider, like a doctor, clinic, clinician, psychologist, dentist, all those kinds of medical providers that are mentioned on the left column. It could also be a health plan provider, like a health insurance company, HMO, company health plan, or it could be a healthcare clearinghouse, like information exchange, that is responsible for ensuring communication and collaboration with multiple entities. The definition of business associate includes anybody who is accessing the PHI, either from a covered entity or from a business associate that is handling protected health information. And the definition of BA has been expanded in Omnibus to include the subcontractors of BAs as well. So a business associate is anybody who either directly or indirectly works with a covered entity and deals with protected health information. And the types of business associates could be varying from an accountant, it could be a legal attorney, it could be a managed service provider, it could be an accountant, it could be an electronic medical provider, even a garbage collector who's responsible for dealing with PHI information either in physical form or electronic form. So anybody and everybody who touches PHI, protected health information, either directly or indirectly, is a business associate. Let me also define PHI as to what constitutes PHI. And PHI essentially relates to individuals' past, present, or future physical, mental, or health condition. And any information that could lead to identifying a personal information, leading to an individual, is construed as protected health information. So it could be things like name, address, birth date, social security number, etc., etc. Anything that could be traced back to a particular person, it's construed as PHI. So before I dive into the HIPAA HITECH details and specifically the HIPAA Omnibus details of what has changed, let me scope out the discussion. So HIPAA HITECH comprises of multiple modules and subparts. We're going to be focused on really the IT related aspects and policy and procedure related aspects that are pertaining to privacy, security, enforcement, and high-tech related issues. HIPAA certainly has a lot of requirements from the transaction and code sets perspective. We are not going to be concerning ourselves with that, or anything related to medical aspects that are not related to IT. So let's jump right into it. So what are the changes brought about by HIPAA Omnibus tool? This was enacted in January 2013 and has been in the works for the last couple of years, specifically after HITECH was enacted in 2009. And the genesis of HITECH has been to really implement and enforce HIPAA regulations by putting together some penalties and some stimulus money to increase the adoption of electronic medical records. So what HIPAA Omnibus has done is to really take the HITECH recommendations and put it to paper, put it to enforcement. So HIPAA Omnibus essentially enables all the HITECH related regulations, but also clarifies a number of aspects that was in HIPAA and HITECH. So let's go through them. So if we jump into the details of HIPAA Omnibus, there are changes recommended to the HIPAA privacy rule, the security rule, the breach notification rule, and the enforcement rule. And we will cover in some detail what those changes are and how it affects both the covered entities and the business associates during the course of the webinar today. So one thing is clearly that as part of HIPAA Omnibus, which was also in HITECH, that business associates are now directly liable to ensure that they are adopting HIPAA HITECH. And not only that, subcontractors that work with business associates are directly liable as well. There have been strengthening and limitations on what can be disclosed for marketing and fundraising purposes, and that covers both the covered entities and business associates. Individuals have a lot more discretion and rights to ensure that they are kept in the loop with respect to any disclosures that happen by the covered entity or anybody downstream with respect to their PHI information. And if any marketing or fundraising is done using the information, the individuals need to be completely in the loop and need to approve before such thing can be done. So that involves changes and redistribution of what is called NPP, which is the Notice of Privacy Practices to the end customer, to the customer, to the patient, or so that if there is any marketing or fundraising that's going to happen using the PHI, the individual needs to be completely in the loop and they need to approve as part of the Notice of Privacy Practices. And the enforcement rules that were in HITECH are now adopted by HIPAA Omnibus, and I'll talk a little bit more about that. So what are the enforcement rules? First thing is that HHS now will be imposing penalties of up to 1.5 million per violation, and there's no upper limit. So if there are multiple tiers of penalties that are imposed depending on whether it's due to reasonable effort or willful neglect. And willful neglect is really the notion that if you are aware, conscious, and still don't take steps to remedy the issues that are found. So for example, every provider is supposed to be compliant starting September 2013. And if they don't take reasonable efforts, if they don't take steps towards dealing with the HIPAA HITECH issues, that can be construed as willful neglect, for example. So there are different tiers of penalties depending on what kind of effort the covered entity or the business associate has made towards doing a risk analysis, towards doing HIPAA HITECH related security and compliance regulations, following them. And covered entities and business associates are liable for the acts of their business associate agents. What that means is that the liability chain, which was earlier stopping at the covered entity level, now moves downstream. And covered entities are responsible for ensuring their business associates and the subcontractors that work with the business associates are completely secure and compliant. And if there is a breach, if there is a misuse of PHI, then covered entities and the BAs and the entire chain of associations are going to be equally responsible. And the final change, the big change, is that HHS is required now by HIPAA Omnibus to investigate, to launch a formal investigation if there appears to have been willful neglect, which, as I said earlier, could be a result of conscious intentional failure or reckless indifference. This is how Omnibus defines it, which essentially means that if you know that you need to do something and you're still not taking steps to remediate, that's a problem. I talked about the tiered civil penalty structure, which has penalties depending on the degree of effort put in and degree, and there are different tiers based on the reasonable effort or willful neglect related efforts that are shown. And the highest penalty there is 1.5 million per violation, and if there are multiple violations, they all could add up. So the penalty structure has been really increased and amplified. There's also now the breach notification rule change, which basically provides guidance on reporting the breach to HHS, versus earlier there was a harm clause and a harm threshold where there was some discretion to be used by covered entities to report the breach or not. And I'll cover this in some more detail as we move forward. And all of this implementation is going to be starting September 23rd, 2013. And as per the latest reports, we believe that OCR is going to be starting a formal audit program starting in October of this year when the new fiscal year starts. Again, this is based on media reports and our conversations with people in the media and the government. So let's dive into a little bit more from the privacy perspective. What does it mean? From the privacy perspective, it means that individual rights have been amplified, and the individual has a lot more information, a lot more discretion, and their rights extend to being able to access the information either in physical form or electronic form. There are complete disclosures that individuals need have access to with respect to how the PHI information is being used internally. If it's being used for marketing or fundraising purposes, then there are limitations, and individuals need to be informed. And there's no use of the information without patients authorizing it, bottom line. The HIPAA HITECH rules, the categories remain the same, which are the 4 categories. The security rule has 4 different categories pertaining to administrative procedures, physical safeguards, technical security services, and mechanisms that are implemented in the business. But these now extend to not just the covered entities, but also business associates and any subcontractors that they work with. And the liability chain extends from covered entities to BAs and subcontractors. And everybody in that chain, liability chain, needs to implement privacy, security, breach enforcement, and the HIPAA HITECH requirements in complete totality as applicable to their scope of how PHI is handled. So from a security perspective, what that means is that anybody in the value chain, anybody in the liability chain, they need to ensure complete security. Besides privacy, they also need to ensure complete security of the PHI information. And whether the information is sitting at rest on desktops, on machines, in physical format, on fax machines, doesn't matter. Or if the data is being sent over the internet, or being accessed on a mobile device, or using a remote VPN. Any sharing of PHI information, whether the PHI is sitting at rest or in motion, needs to be protected and secure.
Anupam, are you there? I think we may have lost you there.
Yeah, can you hear me?
Anupam, are you there? Yep, I can hear you now. Go
Okay,
ahead.
sorry. So if you're a covered entity, there are a number of changes that need to come about. And I talked about first the revision to privacy policies that need to be done. And the revision to the privacy policy comes about because of the new requirements for either sale or marketing of PHI. And this is basically coming from HIPAA Omnibus. It was there in HITECH, which is now reinforced by HIPAA Omnibus. So all the privacy policies have to be redone, and individuals need to be given access to the PHI in electronic form if it's on the web. And this is a revision. Now the notices of privacy practices, so getting the individual in the loop, getting patients in the loop to ensure that they approve specifically any PHI information used for marketing or fundraising purposes or sharing purposes. So the privacy notices need to be changed. And this would basically need to incorporate any use of information for marketing, for fundraising, or if there's a breach that happens. Maybe the breach happened in a covered entity or in a downstream entity like a business associate or a subcontractor. Individuals will have the right to be notified. They need to be notified. Or if there's any genetic information, there is no use of that information for marketing or any other research purposes without any authorization from the individual. So the bottom line is any use of information, whether it's for marketing, fundraising, for research, the individual needs to approve it, and the privacy practice document notice needs to include that approval explicitly. The other big change as a result of Omnibus is the amendment to the business associate agreement, wherein the liability now needs to shift or shared by the business associate. So if you're a covered entity, you want to make sure that any business associates and their subcontractors are aware of their responsibility to ensure privacy and protection of PHI information that they get access to by working with you. And so there needs to be a formal business associate agreement that should outline this very clearly. And if there is a breach for whatever reason, there is a time limit of 60 days that the breach needs to be reported back to you. And this is part of the BA agreement that needs to be outlined and be ironclad there. So there is no compromise with PHI information. And they have a shared liability and shared risk with you as a covered entity. Similarly, if notifications are required, not just by BAs, but also by subcontractors, as I said earlier, and now notifications are, earlier there was a clause of a harm clause to determine whether the breach is going to cause any harm. So that harm clause has been removed and replaced with the requirement that notification needs to happen unless through a risk analysis it's determined that there is very little risk of the information being compromised. So the bottom line requirement is, if you're unsure of it, go ahead and report the breach to OCR, to HHS, and then do a risk analysis to mitigate and show that the harm is going to be minimal. But the assumption is that you're going to be reporting it unless proven otherwise through a thorough analysis the risk of exposure for the individual is low. And finally, if you're a covered entity, all of the changes and the new privacy and security rules need to be communicated internally to employees, to agents that work with you, certainly the business associates and subcontractors that work with you. All of that is required as part of the law. and has been changed as a result of the HIPAA Omnibus implementation that I talked about. So if you are a business associate and subcontractor, then guess what? There's some new requirements that have come about as a result of HIPAA Omnibus. And first thing is the privacy policy that will require you to sign a business associate agreement with the covered entity. And if there are any breaches, then you need to inform the entity upstream. So if you're a business associate, you need to report it to the covered entity. If you're a subcontractor, then you need to report it to the business associate that you work with or the covered entity that you work with. And there needs to be a track record of all PHI-related disclosures or information sharing that has happened, so that when there's an audit trail requested, all of that is made available to the desired party. And certainly training of workforce members and agents is part of the requirement here. The security policy, again, making sure that not just the privacy, but the security aspects of protecting PHI is enforced. And this means that implementing all the security requirements, I talked about the admin, physical, technical safeguards need to be implemented. There needs to be a new security breach incident response policy of 60 days. Within 60 days, you have to inform the upstream entity about any potential breaches that might happen. So to summarize, the game changes really are that now business associates along with covered entities and subcontractors are liable to be audited. They will get audited, especially if there is willful neglect. The fines have increased from $100, which was the case earlier in HIPAA, to $50,000 up to $1.5 million per incident category. And there are new criminal liabilities also that come about due to willful neglect. So you get fined, and the fines could have no maximum limit based on the number of violations, and they could potentially be criminal prosecution. Now, as part of HITECH, as part of HIPAA Omnibus, the state auditor generals can also bring civil actions on behalf of the citizens. And there is some kind of a proceed sharing clause which allows the enforcement agency to share the proceeds with the whistleblowers or individuals who call out certain entities to not be following the HIPAA HITECH regulations and be construed as willful neglect. I talked about the liability chain now extends from not just a covered entity only. It extends now to include business associates and any downstream entities, subcontractors that deal and handle with PHI. And this is part of the law. And there's a shared responsibility that covered entities have to ensure that PHI is shared and protected with the business associates and subcontractors playing their role, playing their part. And I talked about the data breach notification requirements that have changed now. So as you can see, there are significant game changers here that affect both the covered entities, business associates, and not only that, it also affects how HHS is going to pursue any violations that happen. And so it's going to change the landscape of healthcare industry, we believe, and specifically the healthcare IT industry is going to be transformed as a result of some of this implementation, which, by the way, is directed towards increasing the efficiency and decreasing the cost of healthcare administration by enabling sharing of records and thereby increasing the quality of healthcare administration. So the overall objective is good, but before we can get to those realizing the higher objectives, some of these technology implementations need to be in place before the overall benefits can be derived from it. So who's required to implement HIPAA HITECH? So if you're a covered entity, you need to implement it. And there are about 700,000 covered entities right here in the US. And there are about 2 million plus business associates not to mention the subcontractors that work with these covered entities who are now required by law to be compliant by September 2013. And of course, the government has provided stimulus money for covered entities to implement electronic medical records, which is essentially converting PHI information into ePHI, electronic PHI, to help facilitate sharing and improving healthcare administration costs. So that's the carrot, as it were, to make you move towards HIPAA HITECH and implementing electronic medical records. So the question that we often get asked is that why should we care? Does it really matter? How pervasive are breaches? And as you will see, that breaches are very pervasive, and it's affecting businesses of all sizes. There are small businesses who are easy pickings because they do not have sufficient internal staff and IT staff to deal with security and compliance requirements, and so they act as conduit towards breaching into the larger organizations. So SMBs are 92% of breaches affect SMBs, and the large businesses and governments are, of course, getting affected by it as well. And the security breaches of personal health information is pretty widespread. As of 2011, about 8 to 9 million individual records were compromised. State-level breaches have happened. Utah, Alaska are some of the prominent ones. And the breach tally as of March 2013 stands at 21 million individuals. And this includes breaches that affect 500 or more. If you include the 500 or less individual related breaches, the number is approximately double this number. So it's a huge problem. And the official statistics, if you look at, that is maintained by HHS website, is basically reporting roughly about anywhere between 730 to 990 breaches per month. And there are lots of breaches that are pending investigation, and about 25% of the breaches lead to fines. And so this is an active burning problem that businesses are faced with, and it's not something that happens to the other guy, not to me, kind of an issue. There's also a website maintained by HHS which has a running total of all the breaches that have happened so far. And if you go to this website, it's also called the HHS Wall of Shame because it names people and entities that are involved. But you'll see that the breaches reported include businesses of all size. And there are small businesses, there are covered entities, there are business associates that are affected and shown on this wall of shame. And if you do an analysis of the breaches reported, roughly about 50% of breaches are happening because a business associate got breached, and 50% because of covered entities. So it's important and paramount that covered entities take steps to ensure that business associates and subcontractors that they work with are following the law, are compliant, because now they have a shared responsibility and liability to ensure that BAs are following the law. Now, there's another requirement coming from the meaningful risk analysis, security risk analysis coming from the meaningful use that I talked about earlier, where you need to, if you're looking to get federal grant money towards electronic medical record implementation, you have to do what is called a risk analysis, which is part of HIPAA HITECH requirements anyway. So it kills two birds with one stone. And in order to get the money, you need to do security risk analysis, which is essentially, if you do it manually, it's pretty onerous, but I'll talk about certain automated tools that reduce the time dramatically, and it's part of HIPAA HITECH regulation requirements anyway, so you'll be able to do that very easily with the automated tools. So from a HIPAA audit point of view, what does it cover? And it covers the privacy, security, the breach notification rules. All of this need to be documented and be ready to be shown to any external auditor that comes knocking. So in order to prepare for an OCR audit, clearly what the first step is to understand what does it entail. What are the changes in HIPAA Omnibus? What is the law requirement from a HIPAA HITECH perspective? And then go about understanding that and putting together a security and compliance plan that addresses the needs. Specifically, this might involve identifying key champions, key roles in the organization. It might involve training, educating people as to how PHI can be shared and accessed. Then the first step is to understand and do a self-assessment, which will give you a gap report, which will tell you where you stand as an organization vis-a-vis the HIPAA HITECH requirements. And once you do that, you also need to know how vulnerable are the assets that you have in your organization. So that will give you a nice picture of your security, risk analysis picture, which will essentially is another way of saying that given the gaps that exist in the business, given the vulnerability of the assets that you have, here are the chances that somebody can breach into it. And so doing a security risk analysis on a regular basis, along with step 4 and 5, will keep you up to date because things change on a regular basis. So you need to do it quarterly or annually. And then to fix the gaps, to fix the high-risk assets and high-risk vulnerabilities that are found, clearly there needs to be a remediation or safeguards and controls that need to be put in place to deal with the vulnerabilities that are found and to deal with the high-risk items, high-risk gaps that are found. So that is an important part of the whole process, to fix the problems that are found. And of course, one needs to have a breach notification plan to ensure that for whatever reason, if you get breached, you have policies and documents ready to report that. And once you've done that, clearly there needs to be a reward and carrot and stick principle. So once you've assigned owners, there needs to be responsibilities and accountability along with policy and procedures that are put in place to ensure that everything is being followed. And finally, once the remediation is done, you need to document your proof of compliance, proof of the different things that you've done in the organization to ensure, HIPAA's high-tech security and compliance procedures and mechanisms have been implemented. And typically that's done with the help of a document called attestation of compliance or report on compliance that documents all the things that have been done by the organization. So these 9 steps, as we see it, are kind of a bottom line steps that need to be done by any organization if they're looking to ensure that they're HIPAA HITECH compliant, if they want to be prepared for an OCR audit to take place. And I'll spend some time talking about automated tools that help automate the whole process very simply. Now, before I go there, let me talk about what to do if you have an OCR audit request. So typically, OCR audits will be conducted by first sending out a request for an audit, which is sent out by OCR, which will highlight the specific requests that need to be done. And I talked about what typically the OCR audit request would be looking for. So the things that need to be, that will be very useful to address the OCR audit request would be showing them the proof of compliance that you've gone through the steps required by HIPAA HITECH requirements, including list of policies and procedures, including the breach incident reporting plan, along with any training and any policies and procedure documents that have been put in place. And if there's any proof of any encryption for data at rest or data in transit, the security requirements and the privacy requirements from HIPAA HITECH, those are the evidence regarding all of these is required to show that HIPAA HITECH has been implemented and enforced. And I mentioned earlier, encryption is not required, but if there are other ways to protect the data, that's fine. But essentially, HIPAA HITECH requirements need to be shown. Excuse me. The fact that the organization has taken steps to ensure HIPAA HITECH compliance and implementation of HIPAA HITECH related privacy and security requirements is a key step in in meeting the request from OCR. So the question is, given all this background, given all the requirements, what do organizations typically do? It seems very onerous, seems very cumbersome, and typically, traditionally, the solutions have been very manual-driven. They're very expensive, they're very manual and labor-intensive, but we at Gestalt built a solution to address all of these requirements from the HIPAA HITECH perspective, and it's a cloud-based security monitoring and compliance management solution that addresses the complete HHS requirements and more, and I'll talk about that. And it automates the whole process, removes the burden of dealing with all this pre-audit requirements, keeping track of all the things that need to be done. It will help you simplify the whole process. So it supports multiple compliance frameworks. Certainly HIPAA HITECH is a key part of that. And it allows a completely cloud-based security management, vulnerability management. And unlike the solutions that are out there, we don't need any hardware. It's completely software-based. All you need to do is to subscribe to the cloud service and magic will happen in terms of scanning the infrastructure, figuring out the vulnerabilities. Given your compliance requirements, it will tell you where are you missing the bus, what are the gaps, what the security exposure is, what the risk exposure is, and all that. It allows you to automate not just your internal security and compliance requirements for HIPAA HITECH. It will also allow you to automate the security and compliance requirements for any business associates that you work with. So complete vendor management is part of the offering. It comes built in with best practices, policy and procedure templates. So if you do not have the domain expertise to understand what the HIPAA HITECH requirements are, the tool will help you understand that and help you answer questions in a very simple manner so that you have complete guidance from best of class business practices to calibrate what you need to do or what you've done is correct or not. And then it's completely software based, as I said earlier. So the complete workflow is briefly shown here, and it amounts to starting out with either a gap report. So once you subscribe to the tool, you can also download a scanning agent, which runs on your internal site. It's a secure piece of software that will scan your network, tell you what the vulnerabilities are, and tell you how it affects your HIPAA HITECH requirements, and it will give you a risk exposure picture so that you can then work through the gaps and risks that are found to put together a remediation plan. And typically we work with service providers who are reselling the service, who will work with you, the end customer, to put together a remediation plan, or if you have internal people who are capable of delivering IT and compliance services, your internal customers could use it as well, internal employees or chief compliance officer or chief security officer could use it as well. The remediation plan could involve putting together new policies, new contracts that are available in the tool. It could involve putting together new training modules or establishing best practices. So the tool will help you, educate you, guide you to the whole missing pieces. And then you go back and do a self-assessment again to calibrate whether you meet the requirements or not, or otherwise you repeat the process so that you have complete visibility and you have real-time picture of the security and compliance posture in your business. So this is a continuous compliance management tool. It's a continuous security management tool which will help you understand where you're lacking with respect to security and compliance issues, and then work towards fixing those problems that are found while keeping you abreast of all the changes that are happening, all the changes that are needed, and the real-time status of that. There are multiple editions depending on the size of business. So whether you're a small business or a large hospital, the different editions, and different business sizes will use different editions based on the assessments that are needed to be done to meet the HIPAA HITECH requirements, and the tool will automatically scope the set of assessments required for your business size. So let me show you some sample screenshots of the tool. And again, I encourage you to subscribe to the tool that you can download. The free tool that you can subscribe to is a diagnostic tool. It will tell you in a few minutes what are you missing today with respect to HIPAA HITECH security and compliance needs. And once you do the scan, you will get an executive dashboard that looks something like this. It will tell you your security risk posture. It will tell you your compliance posture, whether they are critical or very high. And if you've done your HIPAA HITECH compliance already, you might be surprised that you might be meeting all the requirements. And once you know your picture, then you can essentially drill down and get detailed reports on it. And you can download and subscribe to the tool from egestalt.com. On the main website, you'll see a subscribe link. To give you more details on how the tool works, you basically walk through an assessment questionnaire which poses yes and no questions to you. And you can also upload evidence in the tool. There are inline policy documents that are available to you so that you can either adopt them, customize it to what you need. In case you have existing policy documents, you can use them instead to upload evidence. And inline policy documents are available with the click of a button, which you can then customize and adopt for the organization. There's a business associate agreement that's available in the tool that again you can either adopt as it is or you can customize it based on your requirement. There is enough knowledge base and built-in research available so that if you do not have the domain expertise in HIPAA HITECH or you do not know how to answer yes or no to the questions that are posed, the tool will guide you and will tell you the best practices that are existing in the industry so that you can answer yes or no based on that information. It will also give you a risk model that's built into the tool. So as you're answering the questions, you know whether you've covered the high-risk items or not. It will also tell you through the scanning process, it will also tell you the top 10 vulnerabilities that exist in the business and the assets that are impacted, whether it's a fax machine or it's a printer or it's a laptop that's causing the problem that's high risk, whether it's a mobile device that needs to be protected or it's prone to being breached. So it will tell you the top 10 devices and the vulnerabilities, and then it will also tell you how to fix the problems that are found through a very simple set of guided process. So this is saying, given the vulnerabilities, here are the solutions that you need to do. So if you need to install patches in certain firewalls, or if you need to install antiviruses, or if you need to put together a configuration, change your default password, it will guide you through the process. And at the end of it all, you will generate a report on compliance, which is essentially a proof that you have gone through the process and fixed all the problems. It can also be used as an intermediate stage to understand what needs to be fixed. And the report will give you complete details on all the controls that were checked and what's missing and what needs to be done to fix the problem. Now, the tool will also provide you with certain email templates. For example, if you have business associates that need to be compliant, you can use the tool to scan the network with their permission, of course, and if required, you can send them a mail saying, email or a letterhead saying that they need to be compliant as per HIPAA HITECH law. So the bottom line is that the tool will provide you complete automation, complete guidance with policies, procedures, and best practices and implementation briefs to help you assess your HIPAA HITECH security and compliance issues. We'll tell you where you stand today with respect to the requirements. And from an action plan perspective, here are the key things that any covered entity or business associate needs to do. They need to be able to understand where they stand today with respect to the HIPAA HITECH requirements and understand the gaps, and then work towards fixing the gaps so that the privacy and security requirements from the HIPAA HITECH perspective is completely taken care of. And not to mention building a breach response plans to deal with breach reporting in case any incidents happen. So in closing, I would say Aegify Secure GRC will automate all your HIPAA HITECH issues and make you prepared for an OCR audit. You can also use it for doing security risk analysis, which is required for getting the federal grant dollars. You can use it for BA vendor management program. And if any of you service providers who are interested in offering this service to your end customers, we clearly have a complete marketing, sales, and technical training program to get you started as well. So with this, I'll close my discussion here and open it up for Q&A.
Great.
Mike?
Thank you, Anupam, for presenting. To the attendees, if you have any questions, feel free to ask them in the questions area. Go to webinar, and we'll get them answered. Anupam, here's our first question. What does it mean to provide PHI electronically when requested? What information does that cover?
So PHI, as I said earlier, is related to anything that is related to the individual's health, or it could be related to any information related to the individual. So it could be name, address, social security number. So if the information is available online, which means that if this information is being shared by labs or accountants or legal folks, and the patient should be able to access this information online as well. So whether the PHI is in electronic form or in physical form, the patient should know what information is available with the covered entity, and they should be able to review it, they should be able to audit it, and not only that, if any of that information is shared externally out of the doctor's office or out of a hospital, they need to be in the loop and need to approve it.
Great.
So it's complete visibility and transparency that needs to be put in place.
How is HIPAA Omnibus different from HITECH?
So as I said earlier, HITECH was enacted in 2009, and HIPAA Omnibus includes most of the HITECH recommendations with some clarifications on top of it. So HITECH was kind of an interim rule that was passed to encourage adoption of HIPAA, and HIPAA Omnibus kind of solidifies what was recommended by HITECH. So they're very similar, but HIPAA Omnibus is kind of the umbrella which adopts and which embraces and extends HITECH, as it were.
Okay, great. Thank you, Anupam. We're coming up against the hour here, so I'm going to direct everyone to your phone number and your email address on the screen. If you have any questions after this webinar, feel free to reach out to Anupam by either email or phone number. And we've also recorded the webinar, and we'll have the recording up on Egestalt's website at www.egestalt.com. It usually takes us a day or so to get that webinar up, but it'll be up on Egestalt's website by Friday. Okay, thank you to the attendees for attending. Anupam, thank you very much for presenting today, and I'll leave the last word with you.
Well, thank you all for coming, and appreciate your input. If you want to hear about certain topics that might be of interest to you, we would like to hear back from you and get some feedback on what other topics would you like us to cover. We would definitely try our best to cover them. But thank you today for coming and spending some time with us. Appreciate it.
Okay, great. Thank you, Anupam, and thank you, attendees. Have a great day.